OET speaking, sample test 2 roleplay. Asthmatic child, medicine. This transcript does not contain any language errors. Practice and succeed. Doctor roll card, pause the video and read. Patient roll card, pause the video and read. Good morning, Mrs. Monroe. I am Dr. Paul. I met you a few days ago when you brought your son Frank in. Can I just confirm that you are here for a follow-up appointment after Frank's asthma diagnosis?
Yes, that is right, doctor. I am here for the follow-up appointment.
Great. How has Frank been since his hospital visit?
He hasn't been too bad. He has had one attack since he was diagnosed at the emergency department.
I see. Only one attack since. That's good news. Do you mind if I ask you a few questions just to get an idea of the overall situation?
No, of course not.
How would you describe the most recent asthma attack?
It wasn't so bad, really. When I look back on it, I guess. But I was really worried at the time. Frank is my only child, and I worry about him a lot.
It is completely understandable to be worried, Mrs. Monroe. Try not to worry, though. You are in safe hands now, and we will look after Frank. Did the inhaler I prescribed work well?
He used the inhaler and the spacer that were given to him at the hospital, and it seemed to help his symptoms all right. He was able to breathe easier, and he calmed down after a while.
That is great to hear. Let me ask you some more questions now, if you don't mind, please.
Sure, work away.
Is there any history of asthma in the family?
No, no one in my family has asthma.
What about eczema?
No.
Hay fever?
Well, I usually get mild hay fever in the summer.
I see. You get mild hay fever in the summer. Right. Let me ask you about some possible asthma triggers.
Sure.
Does anyone in the house smoke?
No, nobody smokes. My husband gave up before Frank was born.
Perfect. What about your living environment? Is it dusty? Is there any chance Frank might be exposed to dust and dust mites?
No, my house is not dusty. I keep it very clean. My husband calls me a clean freak.
Great. What about pollen? Have you noticed any reaction to pollen when you are out in the fields or near flowers, for example?
Frank has been as fit as a fiddle up to lately. I don't know what has happened to him.
That's excellent. What about exercise? Any breathing difficulties when he is running around?
Now that you mention it, I think he may be having attacks after he has been running about outside.
I see. That's good to know. So he is affected by running outside. Try not to worry, Mrs. Monroe. We'll soon get to the bottom of this, and Frank will be right as rain. One last question. Have you noticed Frank having any adverse reactions to cold air?
No, like I said, he has always been fine up to now.
Okay, that's perfect. Thanks for the information. I would like to now tell you some information about childhood asthma, if that is okay.
Yes, of course.
Okay, so childhood asthma is a chronic lung condition that affects millions of children worldwide. It is characterized by the tightening or narrowing of muscles in the airways, inflammation, and the production of extra mucus, leading to breathing difficulties. Are we on the same page?
Yes, I understand.
Childhood asthma can impact a child's quality of life and daily activities. Common triggers for asthma attacks in children include respiratory infections, allergens like pollen or pet dander, exercise, and exposure to irritants such as smoke or pollution. Children with a family history of hay fever or other allergic conditions are at a higher risk of developing asthma. Are you following me so far, Mrs. Monroe?
Yes, I think so.
Okay, I'll press on. Early diagnosis and management of childhood asthma are crucial to minimize symptoms, prevent flare-ups, and ensure optimal lung function as your child grows. Regular monitoring by healthcare professionals and adherence to prescribed treatment plans, including the use of inhalers and avoidance of triggers, can help children with asthma lead active and healthy lives. Do you have any concerns about that?
To be honest, doctor, the diagnosis is really overwhelming, and I am not sure how I am going to be able to help Frank manage his asthma.
I understand it is challenging at the beginning, but asthma is a very manageable condition which can be controlled by regular monitoring, and there's a lot of support available to families like yours. Identifying and controlling the triggers, assessing the severity of the symptoms, and knowing how to respond in an urgent situation is very important. You should inform your child's school and anyone else that might need to know about Frank's condition and his requirements when he has an attack. Is everything clear, Mrs. Monroe?
Yes, I feel a bit more reassured about managing Frank's asthma now, thanks.
Let me now please outline the next steps if that's okay.
Yes, that is fine, thanks.
So I'd like to examine Frank and then create an asthma action plan for you. This will explain the treatment in more detail and show you how to get support and make follow-up appointments. How do you feel about that?
That is fine, thanks.
Great. Can I please get your consent to examine Frank?
Yes, of course.
Thanks, Mrs. Monroe. Please bring Frank in if you don't mind.
Thanks, doctor. I will just go and get Frank so that he can be examined.
Thanks, Mrs. Monroe. Pause the video and practice.